Learn some of the best stretches for low back pain. So we have a comment from somebody who's been experiencing some low back and some joint pain into the hip. And what they were asking is if they could have some exercises or stretches that they could do that could be more helpful for their legs, as they found that when they tried to do things like cobra position or knee to chest, essentially more movement to the legs, that's where they were finding some level of relief and maybe just looking for some better exercises or stretches for the area. And what they'll say before we start is, it's always best to make sure that you go and see somebody, whether it's a physiotherapist, a chiropractor, somebody who's trained in looking at this area before getting into too many stretches, particularly if you do already have symptoms going on in that area. Because otherwise you may start to do an exercise or a stretch and it may not be very helpful, or it may potentially even make things a bit worse if it's starting to irritate some of the structures in that area. However, as a general rule, for most people, what I would recommend is to stretch more around the hips and for the legs when it comes to any kind of low back pain or hip pain. And the reason for this is that for most people, the problem is not usually in the lower back, unless someone has, a direct accident or injury, like they had a car crash, or maybe they're playing a contact sport. For most people, it's going to be doing like I'm doing right now. It's being sitting for longer periods of time. It's looking at a screen or a phone for longer periods of time, this sedentary lifestyle. Because all that's doing then is changing the angles that we normally have with our hips and our pelvis in relation to our lower back. And the difference between the hips and the lower back in terms of strength is huge. Your hips are much, much stronger than the average part of the lower back. Your lower back is made up of these are not from the lower back, but you have these bones and you have discs in between. And those bones and discs are nowhere near as strong as one of these one big hip joints, never mind two hip joints. And if those two hip joints start to get much stiffer over time, it's going to start to put more pressure onto the lower back. And your lower back, instead of it moving freely like it should be, almost starts to act like a hinge. It may start to take too much load, it may take too much pressure, and it may move too much. And that can be one of the reasons why it irritates the area and irritates the nerves, not even just locally, but even say down to the leg, which may cause something like sciatica. Due to this nature of people sitting for longer periods and looking at screens, where essentially the leg is going to be, like mine is when we're sitting, coming up more and more what we call a flex position, we need to unflex that position. So one of the best stretches is going to be any stretch for your quads. You can check this online. I'm sure we have some other videos about this. You can find it on YouTube as well. Any stretch is going to be for the hip flexors or quads, something like, say, where you're holding your leg back up, or maybe it's going to be against a wall. That's going to be very effective. And another thing you can stretch then is more of what we call the piriformis, or for the glutes. So essentially these are the butt muscles, the ones that are going across, because as you sit, those muscles, instead of being nice and long like this, they're going to start to be more pressed, and they can start then put pressure on, say, the sciatic nerve or other joints in the area. And essentially it's going to leave your hips more turned out. That's why sometimes you may see some people where it looks like they're almost walking along, like their feet are turning out rather than going straight forward. They may have a lot of tension for those people in those muscles in the piriformis and in the glutes. As an additional stretch, which you can do as well, again, because this is something that affects a lot of people who sit for long periods of time, you can do more stretching for your calves. It may seem a bit strange and a bit unrelated, but for a lot of people, if they have tightness in the calves, it's going to pull on the ankle, on the knee, and that can then start to bring the hips forward, shorten that hip flexor, and can pull on the lower back as well. So definitely stretching out the calves, because also like for me right now, I'm sitting on an office chair, and if you're sitting on an office chair, it's very common, people will sit up on their calves. And if they do, it gets into that shortened position, and we want to make sure we get that longer position over time, and that will stretch things more adequately. The other thing I would actually avoid is stretching of the hamstrings. There are some times where it may be that it has spasms or it is tight, but for most people, honestly, it's not really affected. Because even then, again, I'm in this seated position. If you actually check the anatomy of it, there's not that much of a change in the length of the hamstrings between here and being standing, because it should be rotating with your pelvis. The things that are going to be changing more in terms of their length will be the hip flexors. It's going to affect, of course, what's happening in the glutes, because we're literally sitting on them and they're going to be turning more out, and it's going to be affecting those calves. So those three areas where I would recommend stretching more. And as a general rule for this stretch and for all stretches, holding those stretches for at least 2 minutes each, and always both sides. If you're holding it for 30 seconds, it may feel a bit good, but it won't have any real long-term effect. There needs more time for those tissues to open up and to stay more open for the longer term. So I'd advise maybe trying these different stretches I was talking about and see from there. Otherwise, really, it's best to go and see someone professionally, get a proper assessment, and they'll be able to advise the stretches and exercise which are best for you. Because exercise, especially if you do the wrong ones and you're putting, more strength into those muscles, but you're in the wrong position, it strengthens the wrong position. So it's not always advisable to do stretches and exercises without some level of guidance, particularly if you're already experiencing symptoms. If you're looking to just improve your flexibility, it's very different. But if you already have low back pain, hip pain, maybe leg pain, it's best to get a full assessment first before starting any kind of new regime. If you have any more questions about this, please feel free to drop me a message, put them in the comments. And if you want some more stretches or ideas about this as well, you can also ask, and I'll try to give some more advice.